Technology isn't just a part of our everyday lives anymore. It's become a frontier for global powers, with India right in the mix. So why not join the conversation? Take the Technopolitics survey created by researchers at the Takshashila Institution. It's just 10 simple questions, but your answers could help shape India's strategy in navigating the fast-changing world of high-tech geopolitics. Your voice matters, so let's make it heard.
Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Welcome to an episode of All Things Policy by the Takshashila Institution. I'm Vanshika, a research analyst with the Indo-Pacific team, and today we'll be discussing India's aging crisis. I have with me Leah and Malathi from the Policy School, and we'll be joining them in the conversation today. So just to start off, why is India in an aging crisis? And is it a crisis at all? So we've always had this idea that, India is a young population, but I think we need to take a step back and look at some of the important developments that we've seen demographically. So currently, the Indian elderly population, which is considered above 60, is about 160 million citizens, and this about 10% of the population. And this is expected to double to 20% by 2050. So that would amount to 340 million people. Just to put that into perspective for our listeners, that's the current population of the United States. So it is important to realize that 1/5 of our population will be senior citizen by the time of 2050. And therefore, we need to focus on targeted policy making for them. And we cannot ignore the issues that come with aging. So I'll just start off with some of the challenges that we face in this process. And before becoming too pessimistic, I just want to shed a tone of optimism that India is still at an early stage of aging compared to other developed economies. Yes, they were at a rate where the per capita income was higher, so they were able to deal with an aging society, but we are not there yet, which is why we need intervention from all parts of society, government, and the private sector in order to engage with this issue. So quickly coming to the challenges, obviously one of the first one is health, right? So according to a study called the Longitudinal Aging Study in India, more than 70% of our elderly population suffer from one or more chronic diseases. And this also relates to the problem of lack of specialized care. So about 20 crore of the population is in need of geriatric care, which is scarcely available at facilities. I think in the urban area, we see a lot more of this care available, but in most of rural India, this is not the case. And another challenge is something that we don't often talk about is the problem of feminization. So in India, we know that the sex ratio is skewed, but among the elderly population, it's actually a reversal. So there are more females to males, and this leads to a double burden on the female elderly who are usually poor, who are divorced, who don't have assets of their own. So this is another issue that needs attention. And this ties to the regional differences that we see in India. So we know southern India is aging at a much faster rate than North India. So we see big disparities between states. And finally, touching on, problems of social security. So in a lot of states, the pension is as low as 200 rupees. And a lot of senior citizens have savings in the form of fixed deposits. And we see the rising rates of inflation. So this eats into the traditional modes of saving for the elderly. So these are just some of the challenges that are talked about in the news. I want to bring in Leah here, who has spent a lot of time taking care of her family. So, Leah, I want to bring you in and ask you, what are some of the challenges that you have faced in this process?
Yeah, thanks, Vanshika. I find that for one of the issues that we face when trying to get care for our family is often that we can't like finding caregivers or attendants for the patients is can be quite a task. And especially thinking of people from a lower income background, it's difficult to get especially specialized care depending on the patient's medical conditions. So, finding attendance for the patients is an issue, and finding those you can trust who will give specialized attention to the patient is another hurdle as well, are two separate hurdles in that area itself. Another issue that I faced when trying to take care of a patient is also establishing a system of support. It's not just you and the people at home, but it's also getting your neighbors involved, keeping them informed, having a plan in case of an emergency. So, identifying local hospitals with specialized care for that patient in case there's an urgent requirement. So, there's a lot of people, and that is required to set up the system of support. And it's often the case where people might not want to be involved when you're setting up the system of support. So, that is another hurdle that a lot of people do face. There is also the issue of sourcing medication. Some people can't afford certain medication. For example, some tablets or medication prescribed for diabetes, let's say, are on the higher end. So for a single strip of a certain medication, it could go up to close to 1,000 rupees, right? Which not a lot of people can afford. And if you're having, let's say, 1 or 2 tablets of that per day for an entire month, that can go upwards to about 15,000 rupees a month, right? Which not a lot of people can afford. So, sourcing medication, and not all pharmacies might have that medication available. To order it online might be difficult as well. For those, especially who can't afford to access things online, they have to find other means of sourcing that medication online if it's not available at pharmacies. So, that was another situation. Back to the issue of the attendants. Attendants also need to acclimate to the patient's conditions as well, their routine, and what exactly their condition might entail. There are obviously dietary restrictions for patients, which the attendant would need to be aware of. Maybe issue with nerves and things like that, which the attendant might not be aware of. So there could be an issue, especially, let's say, when you're having a bath, and if you have an issue with your nerves, you might not be able to tell the temperature of the water, which the attendant might not be aware of. So if it is too hot or too cold, it could have an effect on the patient itself. So it's about finding attendants with the right medical training, and also with an attendant that would care enough to be attuned to the patient's symptoms and conditions, right? So there's that. And finally, sourcing of equipment and different things inside the home to make it a safer space for the patient. So it could include something as simple as, you need adhesive bathroom mats that will restrict slipping in the washroom, a grab bar, either next to the toilet or when in the shower area or the bathing area. Having a ramp, let's say in an apartment building, if there's no elevator, that could be an issue. Setting up security cameras outside and inside the home, especially for family members who might have to go out for something, maybe even to buy groceries. And then when coming, if there's an issue, they need to have eyes and ears into what the situation is at home. So, yeah, sourcing of equipment is also an issue, which not a lot of people are able to set up or can afford to set up in their homes. So, yeah, these are some of the challenges.
Right. Right, Leah. You've correctly pointed out many challenges that we face on a personal level. One, as you said, is that the elderly population suffers from low financial and digital literacy. So for us, it's just a click away to order some medicines, but they may not be equipped to do so. And the second, very markedly you pointed out, was the fact that a lot of care that we provide to the elderly is at our homes. It is not possible to keep them in the hospital. So the way we look at healthcare has to be extremely targeted. And you mentioned sort of infrastructural requirements for that, like cameras and making sure the bathrooms and rooms are equipped to take care of them. I think these are some of the healthcare issues that often get overlooked, and all we see is the number of doctors or the bed counts in the hospitals and how the emergency services are. But we must realize that the care that the elderly people need is extremely different. And as you said, there has to be an emotional connection and service that we do while doing this. It can't just be, giving them pills or giving them, certain doing certain tests. It has to be done with a touch of care. Malathi, I want you to come in here and discuss further these challenges.
Yeah, thanks, Vanshika, and thanks, Leah. Thanks for having me on this podcast because it is a topic that's very close to my heart. I've been a caregiver and a primary caregiver for 4 super seniors. They're all 80 plus, both my in-laws as well as my parents, and so I know what goes into just ensuring that you have that support system put around them, as well as what goes into even the emotional care that's required to ensure that they're leading a reasonably comfortable life, right? We need to keep in mind that with the rising elderly population and also the increasing urbanization, that and the evolving family structures, many who are now in more nuclear kind of family setups, as people age, right? One is the emotional, which means even their mental health is affected, but things like loneliness, things like deterioration in terms of their hearing ability, their cognitive ability, their physical ability as well, and this in turn needs somebody who can care for them, support them, and identify this for them. Right, once people start aging, and I'll just like to, I was listening to what Ratan Tata had said when he kind of set up the Good Fellows, which was kind of a support system that he had introduced a few years ago, and he said, you don't know what it is like to be lonely unless you spend time alone, wishing for companionship, and you don't mind getting old till you get old. Because once you're old, many things like your cognitive ability, your mental and physical faculties deteriorate, and you won't know in what state you are. Dementia sets in. Physically, you're not able to do many things, right? The household chores that one could do, and you don't know who you can reach out to, because especially in the urban setting, their family members, it could be their children and or even other close members, are maybe living in another country, right? So it's difficult for them to reach out, even kind of expect that, and unfortunately, the way we might care or tend to, let's say, a child, because seniors too become like children at some point, right? Because the mental, the physical abilities deteriorate. Even a child would be in a similar, like a baby or a toddler, but the amount of attention, the love, the care we would give a child, we don't give to an elderly, because for whatever reason, but we are saying, okay, they're older, they should know what to do, they should know how to respond. But we need to keep in mind that as one ages, and each one ages in different ways, and the deterioration happens at different stages. Their abilities is not the way it was before, and they don't know how to reach out also for help. So the loved ones within that family should extend that support, and that's very important. I'd like to just touch upon when Leah mentioned about attendants, right? Also known as caregivers, paid caregivers. The demand is there now in India, where now many, especially in the cities and the urban areas, where family members are no longer living with the parents, right? So which means that you need to identify someone who can be with them 24/7, who can support. It could be just basic support as to make sure that the food is heated and kept put on the table. It could be just helping ensure that the bath equipment is placed. It could be something as basic as that, attending the door or ensuring the maid comes and cleans the place, to all the way up to more medical support, ensuring the pills are given on time, ensuring that they're assisted for their bath times and other things, right? It goes, and if they're bedridden patients, it goes to a different level. So I think now that the caretaker agencies that have sprouted all over the city, and I'm talking about more about Bangalore because I have experience with that, is that there are a dime a dozen now out there. Unfortunately, many of them are in it because of the commercial value. So there's no empathy that's associated. Though when they do come and they express that the intention of having the attendant is to ensure that the family is kind of taken care of, for them it's just placing someone, just like you would do in any job setting, right? So just to give you an idea of how it works, so essentially these agents will have these agencies, and I'm talking about the ones which have around at least 20 to 30 attendants, would have sourced them from remote areas. This could have been, I'm talking about Bangalore, I'm talking about small villages, maybe in Odisha, Bihar, sometimes even from Kerala, Tamil Nadu, right? So, and they're from small villages where there'll be an agent there locally who promises, just like when they promise any other job in the city, they'll promise the parents there that, hey, we're giving an opportunity for your daughter or son, and this could be 18 plus, and sometimes even younger. So this age verification too is a little spotty when it comes to how they, because the Aadhaar cards can never reflect the true age, right? That can be tampered with. So they're identified in the smaller towns. The parents are promised their safety, and they're given a small cut. So when they're brought to the city, they're housed usually in hostels, and these hostels, they have the food and accommodation is provided for, and then they wait and see who their clients are. So when typically when they are the assessment is done with the patient, let's say I have a I need a requirement, I'll call these agents and I'll say that I need somebody. It's very clear. It's very important that you spell out what kind of attendant you need. You need to specify the patient's height, the weight, because there are times when the attendant should be helping them to support them physically, because this is something that the agencies won't do. Some of them do have an assessment that they ask what is the medical condition, what's the age of the patient, but in most cases they don't. So one will need to be careful about that, because whoever you're getting should be somebody who could serve the purpose of providing the help that you need, right? And once that is done, the caregiver, based on, this could be anything from 18,000 up till 30,000 a month that these attendants, that the agencies charge for the attendant. But the attendant would be just getting a fraction of that, because there's a huge cut that the agency makes. If you look at the numbers, right, if you have someone, an attendant with no skill, this is from 18,000 upwards to 25, 26. But if you are a caregiver who has some expertise, who has some, what we call an RN, registered nurse, for 9 hours, a nurse may cost anything from 1,200 upwards based on the care. And for home nursing, where you're essentially extending what you could do in the hospital, but you'd have a home environment, it's going to be something like 5,000 per day. And advanced care can go up to even 12,000, right? So there's a huge market out there. And, this is one area possibly where checks and balances could be put in place to ensure that there's fairness on both ends for the patient's family as well as for the attendants, that they are being rewarded adequately. And this is an area which is still the unorganized sort of a sector in India.
Malathi, you again pointed out a few important challenges that we face, right? And you also spoke about the lack of empathy that we have as a society. And I think that reminds me, so crimes against elderly are very, very high in India. And there are a lot of family disputes where I know families who have just kicked out their, elderly,
abandoned them,
senior citizens. Yes, they've just abandoned them. So this is a societal issue that we're facing. And I think in recent years, the government has recognized that. So there is a policy called the Maintenance of Senior Citizens and Their Welfare Act, which was brought in 2007. But recently, in 2019, that was amended. And now it's a legal responsibility of not just sons and daughters, but sons and daughter-in-laws and also stepchildren to take care of the elderly, even adopted children. So we see the state coming in because they've realized that there is a diffusion of responsibility at a personal level.
It's also unfortunate, right, Vanshika, when you think of it, because this is just a basic humanity. Right. The fact that the government has to step in is there's so many of such cases where the seniors are being, left in the lurch. Like their financial situation is such where possibly they've the whatever they've earned, then this could be assets which are fixed assets, and they don't know how to handle it. Family members have taken it away from them. This is something that is...
Absolutely.
Right?
So right now, the Act even allows people to complain in a tribunal. And if the victim is above 80 years of age, the decision has to be given within 7 days. But the question is legally increasing this responsibility enough? And are we seeing results of that? Also related to crime, this act also directs the state governments to constitute a special police unit just for the senior citizens. But these all sound very nice on paper. But the question is, how can we realize these policies, right?
Right. Sometimes, right, it's also situational, right? It's not like the family members intentionally are leaving the parents behind. You need to keep in mind that sometimes parents would want to be in the comfort of their homes, and this could be in a tier 2 city, whereas the child has to travel, has found suitable work in a tier 1 or a metro, right? So there are genuine reasons why the child has to leave, and parents are kind of left to take care, and many of them like that. They would like to have that independence, as parents do. But I think it's also where crime rates are increasing, like you mentioned, Vanshika, is because people identify those who are senior, and then they notice that they're living alone. And you have a lot of scams that happen. You have a lot of, and we've seen even the digital scams in the recent past. They've targeted seniors. I know of many cases where my dad received calls, and my father-in-law did, and then they kind of spilled the beans in terms of, this is my family. They shared information which they should not have, but they wouldn't have known otherwise, right?
Right.
The good thing is that as we eventually we are going to be reaching that senior age group, we will be better equipped. Hopefully, in the many decades to come, where we'll be more tech savvy, we will be aware, and so we won't get scammed like this. But we need to keep in mind, even sometimes the elderly, they are happy living alone, but it's just that the society around them should be able to support them. Just, for example, if you have an elderly neighbor, my suggestion is, as society, what we should do is just keep an eye on them, check on them. Once in a while, check on them. Ask them, hey, do you need some help with groceries, with medicines? Do you need some help? Do you want to go for a walk? Maybe every day or every other day when you have the time, accompany them. Right. So these are the small things as society we can do. It will kind of contribute towards not just the emotional well-being of the elderly, who might not be a direct relative of ours, but I think this is, as communities, where we need to step in to fill that gap that has come in because we are more living in nuclear families, and parents are living in a different city as versus their children.
Another point that you brought up, Malathi, was the caregiver economy. Now, that's very interesting because there is a term called the silver economy, which focuses on goods and services for people over 50. And as you said, it's an untapped market. And roughly 35% of the population has a higher disposable income than the other 65%. And currently, this sector only has, a 1.3% market penetration. So, as you said, there is an opportunity for investors to come in and actually build quality-driven solutions. Leah, I want you to come in here. So there is this question of prioritizing commercialization and profit over, actually taking care of the elderly. So do you think, we can bridge that gap in some way?
It is a possibility. I have personally met people who genuinely care, who want to help out, who are ready to help out. Maybe it's not a lot of people, but I definitely think that it's those people who we can ask to assist when setting up systems in place when taking care of patients. So I think there exist apartments or organizations where they have communities specifically to care for elderly people. I know that in Coimbatore especially, there are communities there, sort of like gated communities specifically for elderly care.
Yeah, Coimbatore has become a hub actually as a retirement homes.
Yes, for retirement homes and elderly assistance, medical assistance for the elderly. There are a lot of systems like that. So I do believe that there is a potential, a market for those to come up, and it can be spearheaded by people who care for our elderly population. I think it can be improved by such people. Like we could have training given for the attendants at these institutions with the additional maybe course requirement on empathizing for the patient and understanding patient care, not just the medical aspect of it, but actually understanding things from the point of view of the patient. I do believe that there is an angle of improvement where we can have in, like you said, in these spaces. So, yeah.
Right. That's interesting. So if we take a look at, what some other countries have done, since you mentioned housing. So Singapore has integrated childcare and elder care services in the same community. So that's also promoting interaction between generations. And there is another interesting policy that I learned. So the Swiss Health Ministry has something called a time bank. So that allows people to deposit their time to volunteer and care for the elderly, and then they can encash that as support during their old age.
Okay.
And some countries also provide, tax credits for caregivers because they recognize their role in, as you said, informal caregiving, right? Which is not monetarily compensated.
Right.
But as we've discussed, there is also a toll that the family takes in order to take care of the elderly, right?
And that's a very important point, Vanshika. We talk about the caregivers, the attendants, and others who care for the elderly or any other like post-surgery or right. Now we need to keep in mind that these caregivers too should be in good health, right?
Yes.
So their well-being is important as well. So another thing that as society, what we could do, and if we see people within our family circle or in a network, give them a break. Because as caregivers, they too need some time and space away from that home, and though they might be emotionally attached, and this could be, let's say, the child of a parent, elderly, right? They're taking care of them, but they need that break away. You cannot, because it's the fatigue that sets in both mentally and physically is huge, and that can kind of takes its own toll on the caregiver. So giving those breaks to the caregivers, ensuring that they have health insurance, like if it's an attendant, if you're paying for them. In fact, one of the things that the agencies do when if you kind of opt for a attendant, some of the agencies do this. They say every 2 weeks you need to give them a Sunday off. So one day off when they can just step out, do what they want to do, recharge, and then come back. So I think it's fair enough that these kind of measures have been brought in, but let's keep that in mind. Even as society, we need to remember that even caregivers are humans. I mean, they need to get their breaks, and we can step in and say, hey, you know what, half day I'll take care of your elderly parents at home. Why don't you step out, do something that you enjoy doing, right? So I think these are small things as society we could do for our neighbors, for our relatives, and it kind of really contributes to the overall well-being of the society. And also that feeling of that the elderly are a burden wouldn't be there as much.
Yes, exactly. So since the elderly population is rising, there's also an increase in the dependency age ratio, which exactly refers to the age group of 0 to 14 and above 65 as a burden on the working population. So of course, there is an impact on the productivity, on the economy, but we need to look at it holistically. And we need to understand the impact that it has on the family and on caregivers, right?
Also, I just want to add here that remember that these are not people who are sick. Okay, we need to keep this in mind. So many times, right, when somebody's like my mom's got Alzheimer's, my father-in-law's got dementia. Many times when you see somebody is not maybe cognitively or even emotionally not there, there's a tendency for people, because when they ask the same questions over and over again, or they behave in a certain way, there's a dignity factor that we need to, as caregivers or as family, support them. Because it's very easy and these are the people who have been strong, independent when they were younger. Now they're in situations where they can't remember and they're asking the same question over and over again. Relatives who might come to visit would say, okay, I'm just going to ignore them. I would not want to visit, because they tend to kind of, repeat what they're saying. So ensuring that the dignity of the elderly is something I think as society we should do, because they're well past their prime, but they're not sick. Remember, okay, some of them are not sick. It's just that they're aging and certain things are deteriorating. Right. Another thing that steps in because of this alienation, right, that happens, hearing goes down possibly, so they can't hear. They might say, I didn't hear you. They keep asking you to repeat. Then you kind of try to avoid them. So all this, right, over a period of time creates a depression and loneliness for the elderly also. In fact, Vivek Murthy, the US Surgeon General, who also happens to be my husband's nephew, he had come to India recently, and when we met up with him too, when we were talking about it, and he's really very passionate about addressing global mental health and loneliness cases, right? And he does talk about this even in the US, where because families are all spread out, and there are good palliative cares, there are good geriatric cares in the US, but at some point in time, you want that human connect, right? You want to be wanted. Right?
Yeah.
You're not just going through the motions every day, wake up and then you're like, okay, waiting for bedtime. And then there should be some sort of fun factor involved, right? And that is where I think as society, there are many volunteer groups, even in the US and in India as well. Some NGOs do help out. But I think we can't just be expecting, people from the outside to come in and step in, right? As family as family, when we see that in our relatives, we should step in and just spend that time with them, just having a conversation with them, possibly, right? And then it helps to remove that feeling of loneliness, the depression, of feeling that, oh my goodness, I'm not wanted anymore, because I think the quote unquote utility factor is no longer there. I mean, I think that's the unfortunate part. That's what we're seeing a lot of happening nowadays.
Yes. Malathi, you mentioned loneliness. So actually, the UK and Japan both have a ministry of loneliness that's actually catered to the problems that you very rightly mentioned exist among the elderly population. Because I think in India, we still have a strong family structure. We still, we're seeing increasing nuclearization, but there are still a lot of joint families. And this culture has fast eroded in other industrialized nations like the UK and Japan. So where the elderly people die in their house and no one knows for days that they've actually passed away, because they don't have any close relative also that who are in contact with them. Absolutely. So I think just to put our whole conversation into context, I think we all agree that there has to be a shared responsibility among the Samaj, Sarkar and the Bazaar. Malathi, as this is I think, a triumvirate that we keep discussing in policy discussions, right? So the bazaar has to step in to provide services at good quality, to tap into the market, because there is a need for retirement homes, for qualified attendants. The Sarkar here has an important role, especially to address the poorest quintile of the population, because we forget that more than 20% of the elderly cannot afford basic services. So this is where the government, I think, has a role to play. And obviously, as we discussed, lastly is the Samaj, because all efforts by the government or the private sector will not ultimately be come to fruition if we as a society do not move forward and come
care for
together.
Elders also, right?
Absolutely. So I think this was a great discussion. Thank you, Malathi, and thank you, Leah, for realizing the value in having this conversation and talking about your own personal challenges. Thank you.
Yeah, thanks.
Thank you so much, Vanshika.
If you liked our show, dive into Takshashila's research on technology, strategy, and economic affairs. Check us out at our Twitter handle @Takshashila INST or our website takshashila.org.in.